Well, good day, everybody, and welcome to the Psychological Therapies edition of 5-Minute Psych. In this 5-minute segment, we'll look at biological treatments, starting with an overview of biological treatments before focusing on each type of biological treatment in more detail, including drug therapy, brain stimulation therapy, and psychosurgery. Biological treatments act directly on the brain to reduce symptoms of mental illness. The most common type is drug therapy, which works by increasing or decreasing the activity of specific neurotransmitters. In North America, most prescriptions are for either antidepressants, anti-anxiety drugs, or antipsychotic medications. But biological treatments also include electrical or magnetic stimulation of the brain's circuitry, as well as psychosurgery, in which specific regions of the brain are removed. Now let's look at each of these types of biological treatments in more detail. Antidepressants like Prozac, Paxil, and Zoloft work by increasing the activity of serotonin, norepinephrine, and dopamine, and they do this in one of three ways. The selective serotonin reuptake inhibitors, or SSRIs, work by allowing whatever serotonin that's in the brain to stay active for longer, preventing the reuptake of it. Tricyclics work along the same lines, but also target norepinephrine along with serotonin. However, these antidepressants can cause nausea, weight gain, and possibly seizures. Finally, there's MOA inhibitors, which work by preventing those key neurotransmitters from being broken down by enzymes, another form of reuptake. These are the least used of the antidepressants because they interact poorly with certain foods, like cheese and alcohol. Anti-anxiety drugs like Valium and Xanax are designed to temporarily decrease feelings of worry and agitation without affecting alertness or concentration. They work by increasing the activity of GABA, the main inhibitory neurotransmitter, which slows down nervous system activity. But they often cause drowsiness, difficulties concentrating, memory problems, and they can lead to depression. Maybe most problematic is that they're very addictive, with withdrawal symptoms that include increased anxiety. So when the client tries to stop taking them, they usually end up suffering from anxiety again. That's why it's so important to learn some other tools to deal with the anxiety while the meds are being used. Antipsychotic drugs like Thorazine and Clorazil are considered major tranquilizers. They're designed to reduce symptoms of schizophrenia, particularly if the client is suffering from symptoms that include hallucinations and delusions. Unfortunately, they do little for those negative symptoms like the lack of emotion, motivation, and catatonia. They work by blocking dopamine receptors so that dopamine activity is decreased in the brain. However, it can lead to tardive dyskinesia, a severe motor disorder that's irreversible once it starts, in which the person has uncontrollable facial and body movements, like they keep opening their mouth and sticking out their tongue or moving their hand. Newer drugs are available that don't have tardive dyskinesia as a potential side effect, and they can even treat schizophrenics with negative symptoms, but they can also, in rare cases, lead to a fatal blood issue. There are three ways that stimulation of the brain has been used to improve symptoms. With electroconvulsive therapy, or ECT, the client is given a brief but intense electrical current to the brain as a way to treat severe depression. It's not exactly known how it works, but it might allow the brain to rewire itself and boost the growth of new neurons. The effects are immediate, and somewhere around 2/3 of clients improve. But the relapse rate is also high, and there's a risk of memory loss and brain damage. With transcranial magnetic stimulation, or TMS, depression is treated by delivering a series of magnetic pulses to the frontal lobes by holding the magnetic coil close to the forehead. It's usually done over a series of sessions, and the person is wide awake throughout, with no memory loss afterward. But unlike ECT, the effects with TMS are only modest. Finally, there's deep brain stimulation, in which a thin electrode is permanently implanted in a specific region of the brain that can be stimulated by a device that's inserted just below the skin and controlled with a remote. This has been used to treat depression and obsessive-compulsive disorder, and the effects are immediate. Surgeries like frontal lobotomies that destroyed the connections between the frontal lobe and the rest of the brain haven't been done since the 1950s. But today, in extreme cases, focal lesions are performed in which small areas of brain tissue are destroyed. For instance, destroying a small cluster of cells in the anterior cingulate cortex has helped improve symptoms of people suffering from OCD who failed to respond to other treatments. Well, we just discussed biological treatments by beginning with an overview of biological treatments before focusing in more detail on drug therapy, brain stimulation therapy, and psychosurgery. Now, aren't you glad you had 5 minutes?